Hello everybody, this is Dr. Rahul Manchanda and I'm back with another tip for you. This time we're going to talk about what is hysteroscopy. What is hysteroscopy? Some of you would have heard about it. In the olden days, if a lady had abnormal bleeding or needed to have a cleaning done in the uterus for an abortion, they would do what is called a DNC or a dilatation and a curettage. Now what was that? One would open up the neck of the womb, which is the cervix, to try and enter into the uterine cavity, to then scrape it blindly to take out the tissue inside in order to make a diagnosis or treat a patient. Nowadays, for such problems, we have what is called a hysteroscope or hysteroscope. It's a telescope which is a thin telescope, which again goes through the vagina into the cervix, which is the neck of the womb or the neck of the uterus. We put it there, we put a camera on top of it so that we can see on a big screen without having to look from below what is the problem inside the uterus. Why is the lady having bleeding problems? Why is she not conceiving? What are the things that are abnormal inside the uterine cavity? We can take a biopsy under vision, looking at a huge big screen through the telescope with very enlarged picture. So the chances of missing things are very less. The chances of having a problem or a complication that you would do with a blind procedure is not there. So these are some of the advantages. You can sort of picture it this way. You're walking into a room blindfolded, or are you actually looking with your eyes and going into a dark room? That is the amount of advantage that this small tool, which is a telescope, which is a thin telescope, it's about 5 millimeters in diameter. So it doesn't need, even the thinner telescopes that are newer telescopes don't need to even dilate the neck of the womb, so the patient doesn't have any pain. It can be done under anesthesia, which most of us are doing, or it can be done, if it's a thin telescope, what we call as an office procedure. So you don't need any anesthesia for it also, it's not painful. So a hysteroscopy is when we put this telescope inside the uterus from below with a camera attached, and we're looking at a picture on the screen in order to diagnose the problem of, or the cause really, of why the lady is having a problem. And then you can treat it at the same time. So it's called see and treat. You can actually cure the patient of her problem by removing a fibroid or removing a polyp which is inside the uterus, or taking a biopsy so that she doesn't have abnormal uterine bleeding. We can make a diagnosis as to why she is not conceiving or whether she has cancer or not. It is done for all these reasons. So it's essentially a tool to diagnose any abnormality or abnormality inside the uterine cavity, and then of course treat it at the same time. And like I listed, the advantages are what? It's an enlarged picture, so the chances of missing anything, not able to make a diagnosis, which you can have on a blind procedure like the olden days DNC, is not there. Bleeding is much less, complications are not there, patient doesn't have pain. It's literally an outpatient procedure. Patient comes, gets it done and walks away. These are the various advantages of this tool vis-a-vis the older technology. It can actually diagnose and treat problems to avoid many uterus removal or what we call hysterectomy procedures. So it's much nicer for the patient. You don't need to get larger surgeries done. There are no cuts on the body, literally no cuts on the body. So it's a safer, less expensive, less traumatic, less painful procedure for the patient in order to diagnose the problems and of course treat it at the same time. So this is what hysteroscopy is. Few people are doing it, but those who do it can really help the patient. So if you have any abnormal procedure, any abnormal bleeding, please see your doctor, and if they advise you a DNC, tell them that you wish to have a hysteroscopy instead, which is now the standard and gold standard procedure to see and treat any bleeding problems. If you like this tip, if you've learned something, if you think one of your friends needs to see it for her problems, please share it with them. Until next time, till we meet again, Rahul Manchanda is signing off.